Hi everyone. Welcome to this video on understanding and managing selective mutism. Selective mutism is a complex anxiety disorder that affects both children and adults. Individuals with selective mutism have the ability to speak, but they choose not to do so in certain situations. In this video, we will be discussing what selective mutism is, what causes it, and how it can be managed. What is selective mutism? Selective mutism is an anxiety disorder that affects an individual's ability to speak in certain situations, despite being able to speak fluently in other situations. For example, a child with selective mutism may be able to speak with their family at home but may be unable to speak at school. This disorder is often misunderstood and can be misdiagnosed as shyness, stubbornness, or a language disorder. What causes selective mutism? The exact cause of selective mutism is unknown, but it is believed to be a combination of genetic and environmental factors. Some children may be more predisposed to anxiety and may be more likely to develop selective mutism. Environmental factors, such as trauma or a stressful event, may also trigger the onset of selective mutism. How is selective mutism diagnosed? Selective mutism is typically diagnosed by a mental health professional, such as a psychologist or psychiatrist. The diagnosis is usually made after a comprehensive assessment that includes a review of the individual's medical history, a developmental assessment, and a clinical interview. Managing selective mutism. Selective mutism can be managed through a variety of strategies, including behavioral, cognitive, and psychopharmacological interventions. Behavioral interventions. Behavioral interventions involve gradually exposing the individual to the situations that trigger their anxiety and encouraging them to speak. For example, a child with selective mutism may be encouraged to speak in front of a trusted adult in a comfortable environment before gradually progressing to speaking in front of larger groups of people. Cognitive interventions. Cognitive interventions involve teaching the individual coping strategies to manage their anxiety. For example, a child with selective mutism may be taught relaxation techniques, such as deep breathing or visualization exercises, to help them manage their anxiety in situations that trigger their selective mutism. Psychopharmacological interventions. Psychopharmacological interventions involve the use of medications to manage the symptoms of selective mutism. Medications such as selective serotonin reuptake inhibitors, SSRIs, may be used to reduce anxiety and improve communication. However, it's important to note that medication should always be used in conjunction with other therapies and under the supervision of a medical professional. Conclusion. In conclusion, selective mutism is a complex anxiety disorder that affects an individual's ability to speak in certain situations. While the exact cause of selective mutism is unknown, it can be managed through a combination of behavioral, cognitive, and psychopharmacological interventions. If you or someone you know is struggling with selective mutism, it's important to seek the help of a mental health professional. Thank you for watching this video, and we hope you found it informative.